Hi everyone, Patrick Menninga here, spiritualriver.com. I want to talk to you today about rehab and how it's not necessarily a magic bullet, but it's probably the best bet for anyone who's struggling with drug or alcohol addiction. Now, there's a lot of different solutions out there for drug and alcohol addiction. You might go to counseling, you might go to outpatient therapy, you might have group therapy and have a group of peers that you talk with on a regular basis. You might go to AA and NA meetings. And so there's different solutions for addiction and alcoholism, but the most concentrated form of help in most cases is going to be inpatient treatment. This is where you go to like a 28-day program, you go check in somewhere, you go through a medical detox, and then you stay in residential treatment for generally up to 28 days following a medical detox. And while you're there, you'll go to groups, you'll probably have a therapist that'll work with you directly, and they might try to help you identify issues that cause you to self-medicate. They'll talk about solutions, they'll talk about aftercare, what are you going to do after you leave treatment, try to set you up with the resources that you need to succeed after you leave treatment. Because it's fairly easy to stay clean and sober when you're at an inpatient facility. You're locked down, there's no drugs or alcohol there, there's no pressure, and it's fairly easy to stay clean and sober while you're there. The real challenge comes in when you finally leave treatment and walk out those doors and you're back in the real world and you've got all your freedom back, and now it's all up to you. And what are you going to do? How are you going to manage your life? How are you going to manage your stress and not resort back to your drug of choice? That's where the real challenge comes in. And so while you're in treatment, hopefully you're getting the tools and the knowledge to be able to make those decisions after you leave, to do some follow-up stuff, to go to AA and NA every day, to go see a counselor or an outpatient setting, or do those kinds of follow-up things that you're going to need in order to maintain sobriety. It takes a leap of faith and some real courage to go to treatment. Everybody who goes to rehab for the first time, they're scared. Even if they won't admit it, there's fear there, because what you're talking about is giving away your best friend. You're getting rid of your best friend. Your drug of choice has been there for you, and it's helped you deal with life, and going to treatment, you know that you're giving that up. And so it's going to be scary no matter what. And most people won't admit to that fear. And that's okay. It's okay to be afraid, and it's okay to cover that up as long as you go anyway and deal with your problem head on and walk through that fear and learn how to start living life on life's terms. After you leave treatment, if you're doing the work, if you're actually recovering, your life will slowly get better every day. It doesn't happen overnight. It doesn't happen all at once. And it takes time. It takes time to heal your life. It takes time to rebuild your life from the ground up. And that's the foundation that you can get by going to treatment and going through inpatient treatment. And that 28 days is so critical, because if you just go through detox for like 5 days and then you go back out to the same environment you were in, you almost don't have a chance that way. I mean, it's very difficult to establish sobriety when you go right back into that old environment and you haven't learned anything about going to meetings, you haven't learned anything about therapy or going to outpatient or reaching out to your peers or any of those tools that we use to stay clean and sober. So if you're on the fence, if you're thinking about making a decision to turn your life around, I would strongly urge you to consider inpatient treatment. Go to detox, go to inpatient residential, find a 28-day program. Get on the phone. There's people that can help. There's phone numbers. Call them up and ask them, what do I need to do to get into treatment? Take those steps and start turning your life around.